opportunity to address this distinguished group of industry leaders, researchers and policymakers, and to share with you my perspective on the HIV/AIDS epidemic in America. I say perspective, of course, because I'm the first to admit that I am by no means an expert on infectious disease. I could not hope nor pretend to know more about the biomedical intricacies of HIV than this accomplished audience that I'm talking to. But I can tell you what I've seen with my own eyes and what I know in my own heart, and that is the very harsh reality we are up against, and the very hopeful reality we can and must build together. In a word, the reality we face is this. Despite our many advances, and despite your laudable work, HIV/AIDS is still winning. It continues to devastate populations in the developing world, but the epidemic is also worse than we thought in this very city, and in this very country, the richest and most powerful on earth. This is a reality that too many are ignoring. It is a reality that I think about every single day, and it is a reality that I believe we can change with your leadership. Ladies and gentlemen, reality is something that for many years I tried very hard to escape. I escaped through performance, through drugs, through alcohol, and I escaped through an unsustainable lifestyle. Ultimately, however, reality caught up with me. I was devastated to watch 60 close friends die from HIV and AIDS, friends whom I loved very much. Friends like Freddie Mercury and Ryan White, friends like a young woman who worked in my office and who died because antiretroviral drugs had not yet been invented, and at the time she was sick. She died the most horrible, painful death. And as I watched those close to me suffer, I began to realize how very upside down my own life was. Today, I have been clean and sober for nearly 20 years. I have a balanced life built around Today I have a balanced life built around the person I love the most, the work that fulfills me, and the Elton John AIDS Foundation, which has become my great passion. I created the Elton John AIDS Foundation in 1992 quite simply because I needed to face the reality that during the 1980s I should have been on the front lines. I should have spoken out. I should have done more. I did not, and I'm ashamed. And so today I do whatever I can by raising awareness, funding and hope, all of which we must have in abundance if we are to triumph against HIV and AIDS. Since 1992, the Elton John AIDS Foundation has raised more than $150 million in support of the thousands of projects in 55 countries. We've become the largest AIDS funder in the United Kingdom and one of the largest in the United States. And we have responded to the spread of HIV in communities from Atlanta to Kiev to Soweto. Our grantees provide information, advocacy, condoms, medical care, and emotional support to millions of people. I love this work. It can sometimes be very difficult because we are truly the David of non-profits fighting the Goliath of diseases. We have only 2 small offices in the United States and the United Kingdom. And we are not endowed like the Ford Foundation or the Gates Foundation. Every dollar we spend on treatment and prevention must be raised from private donors, which is a tall order, especially in today's economy. But our work is more fulfilling than I could ever hope to express to you, and it is occasionally more heartbreaking than you or I could ever hope to imagine. Several years ago, I walked into a tin hut in a South African township in Kalicha, where one woman was struggling to support over 100 children abandoned because of AIDS. One of these, a baby girl just 2 months old, escaped death when her mother had committed suicide by throwing herself on a railway track because she was so ashamed of having AIDS. Like many of the children at the orphanage, this baby girl was HIV positive. Of course, the work of scientists in labs around the country and your industry has helped my foundation to bring hope to this little girl and HIV-positive children the world over. Armed with advances in ARV treatment, We have supported the work of other NGOs, which are today providing life-saving medicine in tens of thousands of children around the world. I often have to stop myself and ask, why is it left to my foundation and others like it to address this global issue of existential consequence? The answer, in short, is that collectively, the world's governments and industries are too often ignoring reality. And this creates gaps between what governments and industry are doing to address the HIV/AIDS pandemic and what they should be doing. The reason for these gaps is no mystery. There are long-standing stereotypes and prejudices that inhibit our efforts to combat AIDS. This is an epidemic that must be cured not only by a miraculous vaccine, but by the difficult work of fighting stigma, and through a collective effort to break down barriers and to build bridges where they once stood. And so, where these gaps exist, we do just that. We step in to build those bridges. For instance, some 41% of HIV-positive Americans live here in the South. Yet fewer than half of those living in the South with HIV are on treatment. There are a number of reasons for this disparity in access to healthcare and treatment, and my foundation is working to combat this problem by funding HIV education and advocacy programs. We are also working to fund programs in two additional areas: needle exchange and AIDS education for students, both of which have been neglected domestically. On these two subjects, we have incontrovertible evidence, solid facts about effective intervention born out of research, that these efforts work. There is simply no question that needle exchange and robust education initiatives prevent new infections of HIV. Yet the government continues to ignore this reality for political reasons. Today, people infected through injection drug use account for more than 20% of AIDS cases and represent approximately a quarter of all people living with AIDS in the United States. However, the government prohibits using federal funds for needle exchange, leaving the critical work of helping intravenous drug users to a handful of non-profits, including my own. By simply providing clean needles to those with substance abuse problems, we could effectively eliminate injection drug use as a means of new infection and save thousands of lives. Additionally, 1 of every 3 new infections occurs among young people who are under the age of 30. This underscores the massive work that must be done to educate young Americans not only about abstinence, but also about safe sex and substance abuse. Yet you would be shocked at the materials on reproductive health available to students and teachers in American schools, if materials are available at all. In fact, there is not only a metaphoric gap between the education our young people need and the education that they are getting when it comes to HIV/AIDS, there are very real barriers that have been legislated to prevent students from accessing life-saving